Not saying it's going to be easier, but with Robin in treatment for postpartum depression, I have to believe things are going to get better.
What do we got?
Car crash, female mid-20s, head trauma, unresponsive, pupils equal and reactive. She wasn't wearing her seatbelt.
Any pre-existing conditions?
Yeah, she's a new mother. She gave birth about 3 months ago. It was a single car accident. She wasn't wearing a seatbelt, and it looks like she drove right into an overpass.
Let's go.
Okay, let's start with a stat x-ray, get a CAT scan, get a loading dose of dexamethasone and a mannitol drip. We should get a tox screen of blood alcohol. I want to know why a woman not wearing a seatbelt drives into an overpass. Where are those CAT scan results?
On the way, doctor.
Are those the pictures?
No, that's the results of the blood panel. So the patient has no drugs or alcohol in her system, no history of epilepsy or any other condition that'll cause her to pass out at the wheel, and her last hospital stay was to give birth 3 months ago, and that went well.
There's got to be some sort of medical explanation. The police said the roads were fine, the car was sound. Something going on here. I want to know what it is.
Trisha Bolton's husband just arrived. I thought you might want to explain to him what's going on with his wife.
Okay.
Mr. Bolton, this is Dr. Drake.
Hi.
I was at work when I got the call. Where's Trisha?
She suffered severe head trauma.
How severe?
Well, we're going to run some tests and we'll know more after that.
I don't understand what happened. The police said there was an accident. I should have been watching Trisha more carefully.
And the police report said your wife suddenly swerved her car and drove head-on into an overpass.
Mr. Bolton, has your wife suffered any dizziness that you know of? Fainting spells or anything of the sort?
No, nothing like that. I mean, Trisha hasn't been herself since the baby was born, but nothing like what you described.
Okay, no seizure disorders, severe headaches, anything?
Never. What do you think it means?
Okay. Well, the woman doesn't drive into a concrete pillar for no reason. Something's got to precipitate it, even if she doesn't have a pre-existing condition. Low blood pressure, maybe a slow brain bleed or something like that could cause blackouts.
A bleed in her brain?
It can be corrected with surgery. The point is, the sooner we know what it is, the sooner we can fix it.
When can I see my wife?
She's in trauma too. You can see her for a few minutes before we take her for a test.
All right, let's set up for an MRI and an ICP. You want to get a thyroid panel, estrogen and progesterone levels also.
Do you want me to page you when the patient's ready?
Please. I'm going to go call Robin. What's wrong?
There's no information on Trisha Bolton. It wasn't an accident. She deliberately crashed her car. Her husband says she's suffering from acute postpartum depression.